Good morning, Mr. Yusuf. How are you feeling today?
Yeah, honestly, I'm pretty worn out. I feel tired all the time. I feel shortness of breath. Even small things like walking around my house leave me tired, and I'm afraid of starting exercise because I think then my symptoms will be worse.
Before we talk about the rehab plan, I'd like to understand more about your condition. Can you start by telling me the beginning of your story?
Yeah, I tested positive for COVID 19 about 4 months before. At first, it was not too bad. I was just feeling fever and sore throat, but then quickly it got worse. Then I ended up in hospital. I was there for 10 days, and 3 of them I was in ICU with oxygen, and they said my oxygen level was dangerously low, and I was very scared. After getting discharged from the hospital, I thought it would recover faster, but the thing was completely opposite. I feel tired for all the day, all the time, and I'm really scared about starting exercise.
It sounds like you've had a tough time recovering. Many people who had severe COVID, especially with hospital care, experience long lasting symptoms like fatigue, breathlessness, which can be really discouraging for the patient. How's your breathing now? And are there specific activities that makes it worse, like walking or climbing stairs?
Yeah, it is too hard for me even carrying groceries or walking around my house. Uh, Leave me shortness of breath. Uh, I was too active, and I was used to playing golf, and I miss it now.
That must be tough, especially with golf being something you enjoy. It's common to feel overwhelmed by fatigue when trying to do anything physical after severe illness like COVID. Have you received any advice from your doctor or pulmonologist about rehab?
Yeah, my pulmonologist advised me for the pulmonary rehab to help my breathing and energy. But as I told you that I feel tired and I'm very much scared that if I start these, my symptoms may worse.
I completely understand that fear. The idea with rehab is to gently rebuild your strength and lung capacity. We focus on exercises that are manageable for you, starting with small amounts of movement and breathing exercises. You'll rest when you need to, and will adjust everything based on how you're feeling. It's about progress, not perfection. We'll listen to your body the whole time. So, how do you feel about starting with some basic breathing exercises and light movement to see how your body responds?
Okay, I will give it a try if it is gradual.
Of course, we'll start very gently, focusing on small, manageable exercises. If anything feels too much, we can stop or adjust. I'll be right there with you, guiding you through it. Does that sound like a good idea for you?
Yeah, it sounds good to me.
Great, let's take it one step at a time. I'll start with a quick assessment to understand where you're at physically, and from there, we'll tailor the rehab to your needs. Sounds good?
Yeah, it sounds very good.
Perfect, let's get started then.
Yeah, okay.